It was the first trial in the world to test a COVID-19 vaccine in children, recruiting 240 6 to 17-year-olds to receive the AstraZeneca jab. Tonight, its organisers, the University of Oxford, put it on hold. In a statement, it said, whilst there are no safety concerns in the paediatric trial, we await additional information from the MHRA before giving any further vaccinations in the trial. Parents and children should continue to attend all scheduled visits and can contact the trial sites if they have any questions. The announcement came as the UK and European medicines regulators prepare to publish their latest findings on the safety of the AstraZeneca vaccine, specifically whether there's a link to a rare blood clotting syndrome reported in a small number of adults who've had the jab. Based on current data, the benefits of the vaccine far outweigh any risks.
I think that the best thing people should do is look at what the MHRA say, our independent regulator. That's why we have them. That's why they're independent. And their advice to people is to keep going out there, get your jab, get your second jab.
More cases of the rare blood clotting syndrome have emerged as more doses of the vaccine have been rolled out, but there is as yet insufficient evidence to confirm a link. But speculation around the possibility risks thousands of lives currently being saved by the vaccination rollout.
Put in context of 20 million Oxford AstraZeneca jabs already being administered, and of course between December and February for both vaccines, according to Public Health England, they've saved about 6,300 lives of the over 70. But we stand ready to do whatever the regulator, the UK regulator, ultimately decides.
Vaccination centres like this one in London are reporting people cancelling appointments for the AstraZeneca jab. The evidence says otherwise.
The big story still is that for a middle-aged, slightly overweight man such as myself, my risk of death is 1 in 13,000. The risk of this rare clot, which might not even be associated with the vaccine, is probably 1 in a million. So I'm still going to say that it's better to get the vaccine than not get the vaccine. And we can pause and take time to carefully consider the value for children because they're not at risk of death from COVID.
Our drug regulator first has to establish whether there is in fact a risk associated with the vaccine. The next, arguably harder step, how to balance that risk against the very real harms of COVID-19.